Welcome to the Weigh In Podcast, your prescription for a healthier life, where wellness is more than just a number on a scale. We'll dive deep into not just weight loss, but the medical, emotional, and lifestyle aspects of well-being.
In each episode, we'll weigh in on hot topics ranging from diet myths and exercise trends to mental health and chronic disease management, providing you with the evidence-based advice to guide your health decisions. Remember, it's not just about the weight on the scale, but about creating a healthier, more balanced you.
And now we continue with episode 7, part 2.
Zarina and I talked to another guest in another episode, and during that episode, we talked about how so many people kind of have like an aha moment that sort of changes the tide to where they either decide to start what ends up being their last weight loss journey, and whether that looks like bariatric surgery, whether it looks like a diet. I think that so many of us experience it. And so I just wanted to know if either of you had that, which was like, okay, it's time to lose the weight. I'm going to do the surgery.
I have to give a huge shout out to my therapist who I was chatting with at the time. She was aware of my struggles, obviously, with mental health, with anxiety, and with how often I would talk about how unhappy I was with my body. Like there was just kind of this like threefold package of like, yeah, we're going to talk about my depression this week, my anxiety, and we're going to talk about my weight loss because this is like the thing I'm constantly struggling with. And there was just one session where she was like, have you considered bariatric surgery before? Or have you considered weight loss surgery? And I was like, I had thought about it and I was like, no, that's not for me. I really anytime it came up in my head, anytime it came up as in my frame of awareness, I would brush it off. And I told her that. I was like, I've heard about it, but I just don't think that's for me. And she was like, well, why? She just asked the simple question, like, why? Why is that not for you? And it really, as therapy sessions do, it had to turn into this kind of self-examining, oh, well, was I kind of instilled this wrong way of thinking about it? This did I have these preconceived notions about something I truly knew nothing about? And the answer was yes. And when I had this self-examination period, it really, I would say that became my aha moment of oh, this is a tool that this might be the missing piece of this equation I've been struggling with. I've done it all. I've done dieting. I've done exercise. I've done them both. I've done one or the other. I've really changed I feel like I've done everything I can do. And the more I look up this procedure and this process and people who have had this seems to be the missing piece for them. So yeah, again, huge shout out to her.
Mine is it's a little subtler. Allison made the decision to have the surgery. I just wanted nothing to be but supportive and everything. It was an option that I looked at back in 2007. I was considering weight loss surgery with the same doctor that Allison had that performed her weight loss surgery. Again, life got lifey. It got very different. Things happened, and that wasn't the course. And then I moved up here to Ashland, Oregon, and I visited the doctor and asked about it. Again, because of circumstances at the time, it wasn't going to be paid for. And again, there was a few things. There was I didn't have enough comorbidities, or there was something that they couldn't make it work with the kind of health insurance that I had. Allison's pursuing this. I pick up what are my benefits in Medicare? I pick up, and I see that it's a covered surgery. Oh, wow. And I did so.
Medicare?
Yeah.
I'm surprised.
There's an avenue. You know what I mean? I had my book with me and I looked what are the exclusions? My insurance before I was 65 had it listed as an exclusion. And it was going to be a fine. I was just oh, don't bother. I couldn't even get an appointment with the bariatric surgeons. They wouldn't even accept me because they knew that it was a losing battle. So found out that I could do that. Shout out to Southern Oregon Bariatric Center. who groomed me, if you will, into the process. And everything you guys have been saying prior, there was, if you will, an indoctrination that needed to take place. There were mind prep videos. That's exactly what they call them, because you prep your mind. There's a therapeutic value to really analyzing and changing your relationship with food in any way, shape, or form you can. So meanwhile, I'm going to these classes, I'm listening to the mind tapes, I'm going to doctors, I'm following the suggestions. And during this orientation, they gave me two things. They looked at like my mass body, whatever. And they said, we recommend that you follow this much protein and this many net carbs. So they gave me two, and we recommend that you get this app, this bariatric,
Berrytastic app.
Berrytastic.
Yeah.
And
it's a weight track. It's not a weight tracking, a food logging app, a calorie tracker. Yeah. That kind of thing. It's a MyFitnessPal, very similar, but specifically for bariatric patients.
I can't think of an aha moment without thinking of spiritual guidance. And for me, again, this is my relationship with that word and that verbiage and stuff like that, that somehow it was for me, it was desperation had met mercy and grace. You know what I mean? And it was like, so all I had to do was, put one foot in the other, do this. Everything seemed effortless from that moment on. It seemed simpler. I love the whole thing about, again, the relationship with it's a tool. There's confusion about how it will solve the problem. I got to lose 83 pounds before my surgery just because of the lifestyle change this program offered me. And that is that's what living that best life ever,
Yeah.
You know what I mean? Yeah. It's like all that kind of stuff, the changes in my life, the relationship with so much that I feel invigorated and in a sense reborn.
Yeah, she blew my mind. I basically told her I'm pursuing surgery. This is my date, this and that. And the day I had my surgery, she began her reevaluation with her own weight loss. And she lost the same amount of weight that I did in the same amount of time before her own surgery. Without surgery, there was this neck and neck thing going on where I had lost 40 pounds in whatever months. And so did she without surgery. I was just like, Mom, when was the last time you did that? Please, a round of applause for you. She blew my mind.
So sometimes you need that kickstart. You need someone else to see it. And you're like, okay, if it happened to them, it could happen for me. So I think it's really powerful and really great that you went through that experience and that you inspired your mom to do that. So it's really awesome. And so actually touching back, so you mentioned Medicare. I was saying that it's really amazing that Medicare covered that, because I feel like they don't cover a lot of things, especially bariatric surgery. I feel like that's typically not covered by insurance because it's considered cosmetic somehow, even though it's related to a chronic disease.
Even though it's life-saving, yeah.
Life-saving. Obesity is considered a chronic disease, but it's still not in touch with the healthcare system. So I wanted to ask both of you the process of that. Did both of you guys get approved by insurance, or did you have to pay out of pocket? What was that process like?
I had to pay out of pocket because I have Aetna, and Aetna is a little bit screwy. By most accounts, Aetna does cover it, but the way the insurance works with me and my fiance and the type of insurance we have, it was it's one of the exclusions. It's not included in the specific type of insurance that, he has work insurance from, the company and this and that. So the details of it were such that it was not covered. It was a strange thing where I was initially told it was I looked it up and it said, yes, it's included in my benefits, but, and this is my surgery center, my dietitian was like, hey, so, you know, we've had issues with Aetna in the past. Like, you should really call and like confirm that this is a benefit, that they will cover this for you. And I was kind of like, it's fine. Like, I didn't really, she just gave me the instructions of like, okay, with Aetna, you know, you're not just like cleared to have surgery right away. You have to have 3 months of, you have to have 6 months of diet courses. You have to like take these kind of classes, these nutrition classes. She was like, I can shave that down for you if, you know, do the classes once a week instead of once a month or whatever. I was like, yes, let's do the fast track. But at the end of the day, it was still just like an exclusion in the specific type of plan that I have. I was devastated. Like, I had done all this work and was like, okay, we're sending it off to be approved. And here we're at the finish line where I've been waiting for this. I've been wanting this. I've been documenting this. Like, you know, it's about to happen. And then to just get right there and have that like that door kind of slam shut in your face was just like gut wrenching. Yeah.
I can imagine.
My surgery center like warned me. They were like, you should really check. They were like, you should confirm, like call Aetna, like make sure with them. And I brushed that off. I think I was too gung ho and looking forward to it. And, but, you know, it was at that point like that I had come so far and done so much that everyone was like, well, you're not getting it at this point. Let's pull together and let's help you. We'll do this. And then the funny thing with like procedures and surgery centers is once you say you're paying out of pocket, then they have a surgery date for you the next day. They're like, okay, when you coming? Like, we'll just get you right in.
My experience with Southern Oregon Bariatric Center is they took me by the hand and walked me step by step by step and nothing was too much homework. Yeah, there were some snags. So the doctor has to sign off. You do need a psych evaluation. It wasn't just, this took months. This was in June of 2023, and I had my surgery in February of 24. So it was, and again, it seems like it was yesterday, though. This is what I'm trying to say. Because meanwhile, I'm like adapting and I'm like, the largest benefit of my life is I was benefiting from everything that they were giving me prior to the surgery. So the surgery, again, really was just a bonus. I got asked, well, since you've lost this much weight, do you think you still want to go through with the surgery? And I'm like, oh, yeah, without a doubt. And that's not everybody's experience. Some people don't adapt a lifestyle change before they kind of wait, and then it's a struggle. Alison was nothing but inspiration. I saw her struggles. I ask her a million questions daily.
She does. It's true. It's at least a million.
Is there anything that if somebody were about to start this journey, we're kind of going into this, would you advise them to do something in particular? Do you have like a little like tip or pearl or something that you kind of like wish that you had done, or like a nice to know for those people?
I want to mention on your behalf, Mommy, is you had to do sleep apnea tests and sleep tests. Like, you had to get all these kind of, you were mentioning like the comorbidities and stuff. You had to get these kind of, I don't know, these quantifiers that help insurance process your surgery. So like, as you mentioned, there was this like, if you had a certain amount of comorbidities or not, you qualify or you don't. If you have any obesity related issues, it's not a guarantee that you will be qualified for the surgery. You may think it is, but it might not. So like, confirm with your specific insurance what does and doesn't your insurance coverage, and make sure you know it front to back, just in terms of what's available to you. Be prepared to do more than just show up and get your stomach surgically revised. Like, as my mommy mentioned, you're also going to have to do a psych evaluation. You're going to go to nutrition courses. You're going to have to relearn how to eat. Like, and that is such a like psychological roadblock that I think people are not aware of when they come in. You just hear, oh, my stomach's smaller, like everything else, it's all good from there. That's going to lose the weight for me. It's like, no, you're working with a new system now. You're working with an entirely new machine. You know, our bodies are machines, and when you go and like change the way the gears work, that's going to change the way the operating system works, if you will.
I want to say one thing too, because it was a really scary road. There was part of all this stuff. So I'm having sleep apnea. They're doing an upper GI. They're doing a bunch of stuff. So I've got high blood pressure. Again, these are chronic things that they want to know that you can survive the surgery. So, and I had this thing, a part of me too, that was like, well, if I'm in such ill health, will they deny me the surgery?
You certainly had that fear. Yeah.
There was this misnomer about, oh, I'm too sick to get it type of thing. And that isn't necessarily the case. What all they wanted was some stability. Mm-hmm. So there were several sleep apnea things. There was inconclusive. There was this and everything. But as soon as they got me in the system that says, this is a way, this is the best way possible we are treating this condition. And the same thing with the upper GI, that she is at a point where she is doing the best thing possible to teach. So, and all those things were forward motions, and I thought they were going to be delays.
Mm-hmm. Right. And I wanted to make it clear for our listeners as well. As practitioners, we always have to rule out every other cause that could be causing weight gain. So oftentimes, sleep apnea could be causing weight gain, thyroid issues, anything else. So, I mean, you can do the surgery, but are you getting to the root cause of what's, making you gain weight? And if the underlying thing is obesity, then yes, this makes sense. Yeah. Otherwise, if you have other like autoimmune issues or something going on, it's not going to work for you. So that's why they just like to be very thorough and make sure that they're hitting all the targets that they're supposed to get.
Thank you for mentioning that. I feel like that was specifically the thyroid thing. That was the last thing I tried to address before I kind of was at my wit's end. I would say I started to seek out are my hormones off? Are my thyroid levels bonked? Am I hormonally overweight? Because I also had this, I look very different. My face was riddled with hormonal cystic acne and also being obese. In my 30s, it was just dude, why all of this? Aren't I supposed to be grown out of acne? Aren't I supposed to kind of be at peak physical health? So yeah, I did try the thyroid route too. And
did they give you any parameters? I don't know if you guys have ever seen my 600-pound life, but a lot of my clients have seen it. And in it, he's always you have to lose 50 pounds, and then I'll know that you're serious about getting the surgery, and only then will I do the surgery. So one question I had was did they give you a number that you needed to lose before you had the surgery?
My only requirement was my 3 months of nutrition courses. There wasn't you have to lose this number of weight loss, but that was through my surgery center. I went through the Burbank St. Joseph's surgery center. Every surgery center has a little bit of a different format, and it really ties down to it can even come down to what kinds of surgeries are they even offering? I don't know, a word of advice I have is if you're looking into this surgery, whether it's sleeve or gastric bypass, if your surgery center is offering to do a lap band or, something like that, run. That is a outdated thing that most surgery centers don't do anymore. In regards
and
to...
wait, I'm sorry. As an aside, you're just as a small aside, they are absolutely right. As a general thing, gastric sleeve does tend to have less complications. I just wanted to throw that in there, that it's not anecdotal. It's actually it's
yeah, right.
So they didn't put me on a diet. They didn't tell me what they gave me 90 grams of protein and to be under 50 net carbs. And that was the magic formula for me. That in and of itself was, again, I didn't mind. I've got the app. I don't mind logging my food. And every day was successful. I could hit those terms on the daily. They didn't give me a size number. They gave me a formula
Yeah.
to adhere to.
Yeah.
And support, 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 support.
Yes. I was checking in with my dietitian every week. They would send me a video to watch weekly. And then I was supposed to kind of do a little homework assignment based off this video, this class. And a lot of it was like kind of gentle introduction of like lifestyle changes, like go for a walk 20 minutes every day, and go like my mom is saying, like try to hit this amount of protein in a day, try to stay under this amount of carbs. Like here's the difference between slider food and nutritious food. That's a term in the bariatric community. I'm not sure if it's in other weight loss communities, but so slider food is anything that food that literally like slides through your system and makes you kind of slide off your goals or off track. So things like chips, things like cookies, things that are high in sugar, high in carbs, things that like don't really offer a lot of nutritious sustenance. They just like go through your system and don't provide you with anything. As a bariatric patient, they provide me with like smiles and joy, but
Like everybody else,
yeah. Most of us, they provide me like yum, but that doesn't, aside from that, it's like, oh, they're not giving you very much. And I personally found it so patronizing because this was at a point where I had already made such a commitment to changing my lifestyle. I decided to go with bariatric surgery because I felt like I was a good candidate for sticking to it. I felt like I had the lifestyle that was required of me. Like I worked to gain lifestyle that was required that would equal success. You do hear when you start to like pursue this surgery, you are made aware of like the percentage of people who do gain the weight back, or people who do get revisions from the sleeve to RNY, or RNY to RNY again. Like, that's like, let's just make it smaller. I go to the gym 6 times a week. I eat pretty darn healthy food. I was like, I can see this working for me. That was some of the prep work I had to do leading up. Once I was like approved for surgery and had a surgery date, the prep work was very literal. It was very, okay, we need to shrink your liver before we do this surgery so that it's out of the way, so that it's the lowest. Yeah, I see your face, Serena.
You can shrink a liver? Like how?
Starve it.
Oh, okay.
2 weeks before surgery, we were told to try to stay under 1,000 calories a day, drink protein shakes, you're doing basically a full liquid diet the 2 weeks before surgery. A lot of soups with added proteins, lots and lots of soup, lots and lots of protein shakes. What you're doing is the liver reduction diet, so that when they perform this surgery, your liver like rests over your stomach. And most bariatric patients are obese, and most obese people have, the enlarged liver, like whether it's from alcoholism or obesity or whatever the reason is, we tend to have this like enlarged liver.
Wow. I was also just curious about the actual surgery itself. Is this an overnight stay? How was that process like?
Mine was an overnight stay. It was a 45-minute procedure, like first thing in the morning. I remember my surgery time was supposed to be at 6:30. We were there, and then it got kind of delayed. Finally went in for surgery at 9, and then was out and in recovery by 10:30, 10:40, really, really rapid. As soon as anesthesia wears off, you're in a ton of pain because they pump you full of gas, to perform the abdominal surgery. So the only remedy for that is to get up and walk around. which is the last thing you want to do after you've had like abdominal surgery.
Yeah.
You're like, I just want to go to bed. So as soon as you're kind of ready and able, they're like, okay, let's go for a lap around the hospital wing. Like, isn't that exciting? And you're like, no, but let's go. Like, if this is what'll make me feel better. So yeah, at that point, it's like a 1 or 2 night stay, depending on how that gas passes. If you can show that you can like go to the bathroom like a big girl and like do your own thing, and the nurses are like, are you farting? Are you burping? Okay, that's good. Like showing that your digestive system is doing its stuff despite all this like trauma that it just underwent. Yeah. So my surgery stay was 1 night.
Stacie, how about you?
A little different.
A little different, to say the least.
Close to 4 hours.
Yeah.
There's so many factors. Alison came up here. She flew up to Oregon to be with me and to caretake me while this was going on. She went to the surgeons with me. She got to meet my doctor. Shout out to Dr. Eaton, who told me at my pre-op, I think this is like a few days before or whatever, he goes, it's going to be a challenge, but we'll get there.
I know, he seemed excited. He was like, I'm up for the challenge. I was like,
like, let's do this.
Yeah.
So I'm like, okay, I'm in your robotic hands. Like let's go. Again, the liver shrinking thing was a little different too, because my facility, what was warranted there was they actually even allowed me to drink water up until a few hours before my surgery, because you suffer less dehydration. I was still allowed to eat, Oh
yeah, you didn't have to do bowel prep. I had to do bowel prep.
Whoa.
I didn't have to do that.
Yeah. I had to take, what is it?
Go lightly.
Colon blow.
No, it,
Miralax.
saline. No.
If it's
I
clear,
think so.
Yeah, there's
It was
magnesium
clear.
citrate. It's
Yes.
just a bottle of magnesium.
Yep. Tasted like lemon. Yeah, that was it.
Oh.
I had to have that. Had to specifically have that. Had to have like a potassium tablet a couple days before the surgery. Like, yeah, I had the closer it got to the actual surgery, it went from, okay, you're on your full liquid to like, then it was like, okay, 2 days of clear liquid. Then it went to like no protein shakes, like only broth. Yeah. They really wanted my system
Clear.
empty. Yeah. Like we don't want to see nothing.
A very, very capable surgeon. Very, very, it was again, I'm just like so grateful for the whole experience. And with me, what was going on in my abdominal cavity was adhesions. Mm-hmm. So the first 2 hours of surgery, he's removing adhesions.
Yeah.
Okay.
And that, again, that was a different factor that not everybody is going to have experience with and stuff. And also, which I hear can be common, is I had a hiatal hernia that he repaired. So, and then the weight loss surgery. So the ruin why. So I just like to say that I got a three for one.
Yeah.
But sometimes you don't know those things until they actually cut you open and then they see that.
He knew. He knew.
He knew by looking. He was so
amazing. He looked at my belly. He had me lift my shirt and just looked at my belly. I've had 15 prior abdominal surgeries.
Oh, okay.
So he was, and he would look at each scar and say like, oh, gallbladder, oh, appendectomy, C-section. And I was just like, how do you, anyway, because he's a freaking surgeon is how he knew.
Yeah.
So he was naming off the surgeries from my scars. I had a stoma from anyway, the guy was just, I felt like so, put me in his capable robotic hands.
Yeah, that's why they give him the big bucks. He knows what he's doing. So.
And he's able to communicate it, which is no small thing. Yeah. The fact that you're able to give me this much detail tells me that he 1,000% was doing his job and communicating clearly, which is awesome.
I had just a little shout out to one last thing, a unique experience too. There was a woman who was a nursing student who got to witness, who was in the theater while he was performing the surgery. And she came in, she saw me on the floor, came in, she saw Alison walking me around shuffling around the floor, trying to get, your bowels moving or whatever. And this woman came in and she goes, I got to witness your surgery.
That's so cute.
And I was
That's
like,
adorable.
tell me what happened. Tell me what, and she was like, happy to tell me what she goes, it felt like she knew me in a different kind of intimate way.
Oh,
that
yeah.
was
She
really
I saw all your insides.
Yeah. She was invested.
Anyway, I just wanted to, that note I felt was very special.
So I
That's
wanted to
awesome.
ask too, was it required that you had to have number 2 before you left the surgery place? What was the process of that?
No, not me, because I was constipated for days, and they warned me. They were like, "You're going to be so constipated." I was the most constipated I had ever been in my life because I was drinking nothing but protein and this and that. And I remember the first poo I took was a struggle. And the only solutions were fiber. I take Benefiber now. Hallelujah, I love you, Benefiber. And dieter's tea was kind of the other thing I was trying. It was also a liquid, and Katie knows.
I'm also
smiling.
just laughing because you and your mom are so good with the shout outs. Your mom's like, shout out to the nursing student. You're like,
and I'm like,
shout
brand.
out to Benefiber.
I'm like, product, endorse me.
Yeah, exactly. Not sponsored.
Not sponsored at all. I'll take money, but yeah, not sponsored. No, and it's funny, in the bariatric community, there is this this dependency on certain brands, and Benefiber is one of them. There's a protein drink kind of cult of which team are you? Are you team Ensure? Are you team Premier Protein or Orgain? Where does your allegiance lie? It's all, these brands have become very invaluable in our journeys. They just wanted to make sure that I was passing gas, could urinate on my own, could kind of, the anesthesia had worn off, and made sure I was capable of, being at my house and getting up to walk around the living room every couple of hours or something for the foreseeable future.
Okay.
When each of you got home from your surgery, I'm sure that you were feeling tired, probably having some pain. When did you start to feel like yourselves again?
So I describe it my pain level out of surgery was at a high 8, a 9, from a 1 to 10, 10 being the most painful. I was really up there. I really was struggling with pain. As soon as I could ask, can I please have more pain meds? I did. No shame in admitting I was just in so much pain. And then I feel when I went home, when they cleared me to go home and were like, yeah, you can leave tonight. I was like, really? So much pain. You're going to send, I was dreading the drive home. Oh my God, any bump on the road, anything. I remember being in the car and my brother driving and just being like, oh my God, just get me home. And I lived far from my surgery center. I live 45 minutes away to an hour. I just in LA traffic.
That's far.
James, I know. I was just
Girl, what time did you leave? If you left at 4 p.m., you're screwed.
Oh, you're in there for 2 hours. You might as well go to Palm Springs at that point. Yeah. No, I was just oh my God. No, I was dreading it. They sent me home with maybe, I don't know, 5 pain pills or something. I think I took 2, not at once, but I took 2 doses before I just kind of woke up the next day and it was all of a sudden this level 7 pain was a level 2. It just, for me, it just dropped dramatically. I just woke up feeling like myself one day, and I was oh my God, this really is a pretty, in the grand scheme of things, a pretty painless surgery where I can see how people can return to work within a week, can get back to that. That was my experience. Again, Mommy's was quite different. Quite different.
They want to make sure you're urinating, and they allowed me to go home without having, a
drain.
Bowel movements. I had, and again, my whole situation was different. I had to do Lovenox injections to prevent, so I had to inject myself twice a day. There was like this medicine that I had to take out. So that was one of them. And again, I had more bruising on my stomach from the Lovenox than I did from the surgery. It was snowing. Poor Allison. I'm like, come on up and take care of me and everything. And we have
Did you drive her home?
She drove in the snow to come and get her mama.
Yeah.
But we were snowed in for one day. If you don't feel confident to drive, and I don't have like stud tires or anything.
She doesn't have like a Subaru. I wasn't like confident in driving.
I am not ready.
Yeah, I was like, I live where it's sunny and golden. I'm not driving in this snow. No, ma'am. But yeah, your surgery was on the Thursday and you didn't come home till Sunday.
Again, I was in a lot of pain where the first couple of days it was like, I don't know how they regard that. They were giving me injections, like every so many, whenever I needed them, basically. And then I was able to take a pill and they controlled. And then when I came home, I was on prescription pain medicine for about 2 weeks post-op as well, which is a lot longer than Alison. And again, but my procedure was different.
Yeah, many of your factors were different. You're in an older age bracket. You do not have you don't have like a athletic physique that I had. That there was so much that differentiated our experiences.
Then we had to go back on a Monday and on a Wednesday for hydration. I had to go for IV hydration.
Oh,
yeah,
for 2 days. So we did that. I got, I had like the first week or so out, I had a dumping syndrome experience and stuff. I physically, there were some challenges for me. I wasn't regulating the water, whatever it was, as pre-op ready I was and all the weight I lost. This is a different freaking ball game right here. You know what I mean? It was like, they mean it. Chew your food so like it's applesauce consistency. Don't do, and then certain foods that I had no trouble with prior, all of a sudden I'm not tolerating. And yet we're still talking about soups. Those Pacific and Imagine soup. Shout out!
Shout out number 10.
That's a big part of like the liquid diet. You want something savory.
Yeah.
Shout out to soup.
Shout out to
So
soup.
bland. Yeah.
And and again, you're putting protein powder in it, and whatever I could take one sip too many and
ruin your night. Yeah. This is what I was talking about earlier when I mentioned like you need to be, as a bariatric patient, you need to be up for the challenge of like relearning the way you eat and the way you interface with food. There are like rules to how you live your life now. I don't eat and drink at the same time. That's something that's like never going to be on the table for me because of how much your system has changed. Like just this quote unquote simple change of like my stomach is smaller and now there's a different like route that like my digestive tract takes and my like, all this, the changes that were made. There's no room for both liquid and food. There's no sipping and eating at the same time. It's 30 minutes after you have a drink, you wait 30 minutes, then you can start eating. Thoroughly chew each meal. I had like guidelines down to the like, okay, give yourself 30 seconds to chew each bite, swallow, wait 30 more seconds. Your meal should take you, your 2-ounce meal, which to a normal human would be 2 bites. That should take you 30 minutes to consume. And it's just this like different ball game of going from, someone who is a foodie, a self-described foodie and like loving eating and, can get competitive with how, oh, you were hungry, you ate that burrito in 5 seconds. Like, I've been that person a lot. So to change all of that to this, like, okay, you have to choose, like what she was saying, choose so slowly, like engage with your food differently, was really a learning process and a huge learning curve.
Wow. Well, that's so amazing that, again, you guys have gone through this process, and thank you again for sharing everything. Like, there's so much that I don't know. Like, honestly, I should probably know the different types of surgeries and stuff. I will look this up. But yeah, I didn't know. Yeah, there's gastric bypass, gastric sleeve, and so it's really awesome that I love that you both came on, because I know, Stacie, that you were a little hesitant to come on at first. So I'm so happy that at the end of the day you still wanted to come on.
So happy that you guys came. This is going to be such a helpful episode, especially for people that are considering doing it. And I really appreciate how candid you guys were.
Yeah. But I did want to give you guys a chance to plug your social media handles. And so if you wanted to.
As you mentioned, I'm at Olive Alley on Instagram. That's my bariatric diary, if you will. I share like what kind of foods I'm eating. I have side-by-sides. I have some of my mommy's side-by-sides. And, I do a weekly kind of check-in with, just kind of a content warning. I post my weight and I post my measurements. So if you're kind of in a place where you're uncomfortable seeing that, like just be forewarned. I'm pretty candid. I curse a lot. I'm a pirate, I guess. Yeah.
Oh, Stacie, did you have any? I don't know if you're on social media.
I got nothing. I was going to say, my plug is for a good time. See my daughter.
See my daughter. Oh, Lord.
Oh my God, I love you guys. You guys are amazing.
You guys are the best.
Thank you.
Serena very much so undersold you. She was like, oh, yeah, this is really nice. She didn't tell me how fun you guys were.
Aww. I had to give it a surprise. You got to learn for yourself. This is what I came in with. This is who I met when I was little. They have not changed, like, in a good way. Honestly, no, I love it, because like growing up, my parents were very like strict and da-da-da. So it was kind of cool kind of seeing, oh, okay, you can have an open relationship with your mom. You could talk about everything. Like, that's weird.
Yeah, these guys are weird. Those like those witch hippies next door, like, stay away.
Oh yeah. So yeah, thank you so much again. So appreciate it. And
Okay.
You too.
Bye-bye.
Bye-bye.
if you've enjoyed today's episode, please take a moment to subscribe to our podcast, give us a rating, and share with your family and friends who might find it helpful.
And remember, we love hearing from our listeners. Connect with us on our social media channels or shoot us an email with your thoughts, questions, or suggestions for future topics. Don't forget to check out our website, www.thewayinandpeas.com, and to follow us on Instagram at thewayinandpeas.
If you need one-on-one help with your weight loss or wellness journey, book a private consultation with us. The A-List Clinic can be reached at www.thealistclinic.com or on Instagram and TikTok at The A-List Clinic.
And my clinic, Lifefire Weight and Wellness, can be reached at www.lifefireweight.com or on Instagram and TikTok at lifefireweight.
Thanks again for tuning into the Wayne Podcast with your hosts, Katie and Serena. Until next time, take care and be well.
The information in this podcast is for general information only. It is not intended as medical advice and should not be relied upon as a substitute for medical consultation with a qualified medical provider familiar with your medical needs.